Hey guys, welcome to this BLS training. This is the first step in our medical training, which every soldier here has to do. We have a medical mod in here which we tend to use. It makes this medical system a lot more realistic, but also a lot more complicated. So we thought we give everyone that plays with us a little baseline of what you can do to stabilize someone once he gets shot. So far so good. Let's get into it. Just going to grab my bag. The stuff you have with you. It's just simple stuff. You have a chest seal, a thing that can close up a penetrating chest wound, so the you have no air entrapment there. The air can get back out, and the lung can inflate properly again, so the patient can breathe. You have elastic wraps, just a securing bandage basically that you can wrap around already existing bandages so they don't reopen. You have emergency disposable suction bags, which are basically it's this medical suction that you can suck out vomit or blood, for example, out of the mouth of a patient, so the fluids don't get into the trachea and the patient can breathe. Next thing is an emergency trauma dressing. This is the bandage we're going to use the most, but I'll show you later. Next thing, iGel. It's an airway device that you can insert into a patient's airway to stop the fluids to go into the trachea, so it blocks it. And you have a secure airway for the patient, which he can breathe through. Pressure bandages. Another kind of bandage, we'll go through it later. Tourniquets, I think pretty self-explanatory. It cuts off blood flow to a limb, so the patient doesn't bleed anymore. Splints is used for fractures. You mold them to the fracture so the arm doesn't move anymore and the fracture doesn't dislocate. It's basically keeping it stable. And the last thing is paracetamol, pain medication in form of pills that you can administer to a conscious patient through the mouth. Okay. So far for the items. And now simple stuff. We're going to spawn a normal patient at first to show you what kind we can do. And then we're going to show you a insane patient which we stabilize then and actually try to keep stable until real medics roll in after. You could see now we have a menu here, which I opened with pressing H when I look at the patient. If you guys know, it's the menu from ACE, from the ACE mod. We have some more stuff here, but not to worry about it. You see this menu, you can click on head, torso, arm, leg and leg to select those. You can see these yellow parts. For example, on the arm earlier, on the leg, which basically tell you, okay, the patient is bleeding in any way. Now you can see it turned blue. We didn't do anything here, but just to show you how the wounds can clot in this mod. So basically, blood has some clotting agents in it, which when the blood flows, get activated on air, and it seals the wound off internally without us doing anything on bandaging. But it only works on smaller wounds and when the body still has some clotting agents in there. On this patient it worked, which is perfectly fine. So now we can see he's not bleeding anymore, but he lost some blood, as you can see here in the bottom, in the top right side. These red things here, the bones, basically means, okay, we have fractures here, which we can splint. I already told you, but we're going through an algorithm here where we treat the bleeding first, which the body did itself, so we don't have to do anything. Next thing, airway. On this one, we can check the airway. Takes a little bit of time. You do that by navigating to the head, then on the airway management, the mannequin here with the 2 lungs on it, and click check airway. And then it tells you in the bottom here, light obstruction. Which basically means we're doing a suction to get the obstruction out of there. And as you can see now, when we check again, you should see the airway is clear. And now we can insert the eye-gel to basically secure the airway and giving him a way that he can breathe through. So, airway is secured. Next thing, we're going to check if he's breathing. General, if he's not breathing, do CPR. I'm going to tell you how. Now you can see medic check breathing, and it's rapid. So we know, okay, he's breathing, but his breathing is rapid. We don't worry about this rapid breathing at this tier. We just know, okay, he's breathing, we can move on. If, for some example, he won't be breathing, you click on the chest, then on this ECG line here, advanced treatments, and then you see here begin CPR. And you just continue with the CPR. That's it. Okay, next thing, circulation. We can click on the head, for example, click on examine patient, and then feel a pulse. You can see this heart now, this icon, which is beating. This now tells me actually, okay, this is the frequency the heart beats in, so we have a pulse. And the bigger the heart is, the higher is the blood pressure, so you feel a strong pulse here. This is a carotid pulse, so it's basically on his neck, the arteries, which is quite central, so the pulse is it's typically very strong, as you can see here. If it would be very weak, we have a problem, but we don't really worry about this on this tier. You just can check the pulse if he has some. You carry on. If he doesn't have a pulse, you do CPR. Next would be hypothermia on the algorithm, but we don't really worry about this. That's for the more advanced medics because it doesn't kill the patient immediately. What you can do now is actually splint those fractures. So you click on, for example, the arm, click on the bandaging, then apply splint. It takes a time. And as you can see now, this bone turned from red to blue, which basically means, okay, it's splinted now. He can move his arm again. And we can do the same with the leg. And that's it. We've stabilized the patient. He's still unconscious, lost some blood, but we don't really worry about this so far. He's stable. We can drag him out, which you can actually do. Open the menu. Click then on this this person carrying another here. And then you can either drag the patient where you have your weapon ready, but only can drag backwards basically, and you're quite slow with it. Or you can carry the patient, but you won't have your weapon ready then, but you're a little bit faster in carrying him. So if you're together, I'd suggest carrying him, which I'm going to do now. And my fellow comrade here is going to cover for me when we move. So we're taking him here to this medical tent, releasing him, and we got him to safety. That's it. So, one other thing. If, for example, this patient would have a injury on his chest. Wait, let's grab a patient that maybe has that already. I'm just grabbing my stuff back. One quick second. So let's grab, for example, an insane patient. We're doing this hardest difficulty patient now to show you can even stabilize a patient. Yeah, with this tier, doing some basic stuff. But it's not likely that you will do this on your own. We will have other people there that help you. Just to show you, this is how it looks like. Yeah, and as you can see now, we have a torso injury and a head injury. So I'm immediately starting to bandage head and torso, while my comrade here is bandaging the limbs.
Bandaging the legs.
And as you can see here, we have the pressure bandages, which bandage 2 wounds, and the emergency trauma dressing, it bandages everything. Like I told you, we're mostly going to use the emergency trauma dressing because it's easier. And now we've stopped the bleeding. Next thing is the airway, so click on the head, check airway. And airway is clear, so I can immediately insert the eye-gel. We don't have to do the suction. And he can breathe again. Next thing, we have a large crushed tissue and a large scrape on the chest. These are non-penetrating injuries, so it's only on the upper layers of the skin, or a crushed tissue basically, which we can't treat with a chest seal. He can bleed internally into the chest, but we don't worry about this on this tier. For this, we just worry about a penetrating injury on the chest, which then would basically show you on this airway management when you click on the chest, apply chest seal. If you see that, apply chest seal, do it. Click it, chest seal on, don't worry about it anymore. And that's basically it. So now, okay, we have an eye gel in, we can check the breathing. He's breathing normal, which is perfect. So now, continuing to check the pulse. And he has a pulse. So, we're pretty much done here. Patient is saved. We can move in out. And wait for the higher tier medics to roll in and properly treat him. If you guys have any questions or want to do a live session with it or something, reach out to us. We have a Discord channel. It's linked in the description. And this video will be linked on the Discord channel as well. So if you're navigating through the Discord channel and got to this video in that way, you already know how to reach out to us. But in case you don't, we have a Discord channel. You can connect to us, you can talk to us, ask questions there. We can schedule in live sessions where, we as medical trainers would get you in here in the scenario and teach you through it if you want. That's it for today. Thanks for watching and see you guys in the next one.